Testosterone is much more than a simple male hormone. It is the foundation that supports energy, vitality, libido, muscle mass, bone density, and even mental clarity in men. When its levels are adequate, the body functions in balance, sexual desire remains active, and overall health seems protected. But when production drops, life changes drastically. It is precisely at this point that doubts arise, and along with them, fears. Men who come to the clinic always report the same concerns. Will my penis shrink if I use testosterone? I heard that the testes can atrophy. Is that true? And sexual potency, will it be compromised? These questions are repeated because hormone replacement therapy is surrounded by myths. The truth, however, needs to be explained based on scientific evidence and without illusions. Testosterone can bring enormous benefits when used correctly, but it can also cause significant side effects if mismanaged. What many do not know is that testosterone deficiency is a real condition, recognized by medicine, called male aging androgen deficiency. It is linked to chronic fatigue, loss of libido, erectile difficulties, muscle weakness, and even osteoporosis. It is not a matter of aesthetics or vanity. It is health. Therefore, in this video, we will detail what actually happens to the body during testosterone replacement. We will understand whether it can or cannot alter penis size, what are the real risks to the testicles, and why so many men report improvements in potency and vitality soon after starting treatment. Let's begin. What is testosterone and why does it decline with age? Testosterone is produced mostly in the testes, under the command of the brain, specifically the pituitary gland. It is what gives men their masculine characteristics, a deeper voice, the presence of a beard, muscular strength, physical and mental energy, as well as sexual function. When young, the levels of this hormone are high, ensuring vitality and performance. But as the years pass, production begins to naturally decline. This process even has a technical name: male aging androgen deficiency. Commonly, many call it andropause. This decline is not just a detail in blood tests. It translates into clear symptoms, and often disabling ones. Constant fatigue, discouragement, loss of libido, difficulty maintaining erections, decrease in muscle mass, increase in abdominal fat, bone fragility with risk of osteopenia and osteoporosis. In some men, the impact is so profound that it compromises quality of life in all aspects. It is in this scenario that hormone replacement therapy comes into question. The goal is not to give an artificial advantage, but to restore to the body what it can no longer produce in sufficient quantity. However, along with this legitimate need, controversies also arise. Can testosterone alter penis size? Do the testicles really shrink? And what is the relationship with the prostate? These are the questions we will answer next, separating myths from facts and showing what science has already proven: the impact of replacement on the penis and testicles. When a man starts testosterone replacement, the first question that arises is, will this change the size of my penis? This is a common concern, but it needs to be clearly explained. The penis itself does not decrease with hormone replacement. On the contrary, many men report the sensation that it is larger. This happens because, by restoring adequate testosterone levels, blood circulation improves, erections become more frequent and consistent, and the regular use of the organ brings back a vitality that was lost. Additionally, testosterone promotes fat burning and the gain of lean mass. With the reduction of abdominal fat and the pubic region, there is a visual effect that makes the penis appear more exposed, giving the impression of an increase.
Regarding the testes, the situation is different. They are the body's natural factory for testosterone. When production is supplemented by external hormones, the brain understands that it is no longer necessary to stimulate the testes. The result is that they can gradually decrease in size, entering a process called testicular atrophy. This does not happen immediately, but with prolonged use, the testes may stop producing as much testosterone as well as sperm. In practice, this means that younger men who wish to have children should be very careful with hormone replacement. In older men, where fertility is no longer a priority, the main concern is simply to keep hormone levels stable to preserve health, energy, libido, and quality of life. Therefore, the truth is simple. The penis does not shrink with replacement. On the contrary, it may appear larger due to improved circulation and weight loss.
The testes, yes, can atrophy if the treatment is continuous, since they stop being stimulated to produce testosterone naturally. The risks of stopping hormone replacement therapy. One of the most delicate issues about testosterone replacement is what happens when the patient decides to stop. Many men believe they can simply discontinue the treatment and everything will return to normal. But the reality is not quite like that. If the body already has a testosterone deficiency, whether due to natural aging or another cause, replacement is precisely to correct this failure. When external hormone is abruptly removed, the body, which was already not producing enough, becomes even more critical. Symptoms return strongly: loss of libido, impotence, constant fatigue, irritability, insomnia, loss of muscle mass, and bone fragility.
Furthermore, if a man has used testosterone for a long period, the testes may have lost much of their natural hormone-producing capacity. In this case, abrupt discontinuation leaves the body without any support, which can be devastating for physical and mental health. In some younger patients, there is a chance of partial recovery of natural production after stopping treatment, but this is not guaranteed. In older men, the need for replacement usually becomes permanent, and withdrawal can mean an irreversible setback. Therefore, any decision to reduce or stop testosterone use should be made gradually and always under medical supervision. Replacement cannot be seen as a temporary experiment. It must be treated as a health commitment, adjusted to the minimum necessary doses, but with consistency and responsibility. Testosterone and prostate cancer. Few topics generate as much controversy as the link between testosterone and prostate cancer. For many years, it was believed that the hormone acted as a direct fuel for tumor growth. This simplistic view led doctors and patients to associate hormone replacement therapy with an immediate risk of cancer. Today, science understands the issue more balancedly. There is no evidence that testosterone replacement in healthy men causes prostate cancer. What does exist is concern in patients who have already had the disease. This is because in men with active prostate cancer, testosterone can stimulate the growth of malignant cells and accelerate the progression of the disease. And for this reason, when prostate cancer is present, the recommended treatment is often exactly the opposite, blocking the body's testosterone. This blockade can be done chemically with medications that nullify hormone production, or even surgically through what is called castration. In these cases, testosterone levels drop to zero, which can lead to a reduction in libido, energy, muscle mass, and even penis size due to disuse. In patients without a history of cancer, the scenario is different. Replacement therapy, when properly indicated, does not increase the risk of developing the disease. What is recommended is vigilance, regular medical follow-up, blood tests and imaging when necessary, and special attention to any suspicious signs. Therefore, the relationship between testosterone and prostate cancer needs to be understood precisely. Replacement therapy does not cause cancer.
Yes, in men who already have cancer, testosterone can accelerate the problem. And for this reason, every patient on hormone replacement therapy should have constant medical follow-up and periodic examinations. Other causes that can lead to penis reduction. Although testosterone replacement does not reduce penis size, there are other medical conditions that can indeed cause this effect. It is important to understand each of them, as patients often confuse the reasons for the change and wrongly attribute it to hormone replacement. One of the most common situations occurs after prostate surgeries, especially in cases of cancer. During prostate removal, surrounding structures can be affected, and this can result in perineal shortening. It is a known consequence of the procedure, not of testosterone itself. Another condition is cavernous fibrosis, which occurs when the cavernous bodies of the penis, responsible for erection, undergo internal scarring. This can happen in situations such as priapism, which is a prolonged and painful erection. This fibrosis alters the tissue's elasticity, reducing its ability to expand during an erection, and over time, can lead to a real decrease in penis size. There is also the so-called Peyronie's disease, characterized by a pronounced curvature of the penis. In more severe cases, surgical correction may be necessary. Although this surgery restores function and alignment, it can reduce the length by 2 to 3 centimeters, depending on the severity of the curvature. Additionally, prolonged disuse situations, common in men who have had low testosterone levels for years without frequent erections, can give the impression of shrinking. The erectile tissue loses elasticity and local circulation decreases, reducing penile vitality. Finally, there are cases of hormonal blockade treatments in patients with advanced prostate cancer. As we explained earlier, in these cases, testosterone is deliberately reduced to zero. The absence of this hormone leads to loss of libido, reduced blood circulation, and over time, can indeed result in a decrease in penis size. These examples make it clear that not all responsibility can be placed on testosterone. There are various medical, surgical, and functional conditions that can cause real changes in penis size. Benefits of testosterone replacement therapy on quality of life. Testosterone is not just a hormone related to sexuality. It acts on virtually all systems of the body. Therefore, when properly replaced and monitored by a doctor, the benefits go far beyond libido. The first noticeable effect is the recovery of energy and disposition. Men who previously complained of chronic fatigue and lack of motivation report a significant improvement in mood and daily vitality. Another important benefit is in muscle and bone function. Testosterone stimulates the gain of lean mass and reduces body fat, which not only improves aesthetics, but also protects against sarcopenia, the muscle loss typical of aging. Additionally, it strengthens bones, reducing the risk of osteopenia and osteoporosis, conditions that lead to severe fractures in the elderly. In the sexual aspect, the effects are also clear. Replacement promotes improved libido, increased frequency of erections, and greater penile firmness, restoring confidence and quality of intimate life. In many cases, patients report even a feeling of rejuvenation, as if they had regained part of their youthful vitality. From a metabolic perspective, testosterone is associated with a reduction in abdominal fat and improvement in glycemic and lipid profiles, indirectly contributing to the prevention of cardiovascular diseases. And we must not forget the impact on the mind. Studies show that adequate levels of testosterone are linked to better mood, lower risk of depression, and greater cognitive clarity. This means that properly replacing the hormone is not just about improving the body, but also about protecting the mind. In summary, when done responsibly, testosterone replacement can transform a man's life, restoring energy, strength, desire, confidence, and health in various dimensions. Conclusion: the truth about testosterone is that it is neither an enemy nor a miracle cure. It is a vital hormone that supports male health in various aspects. When it drops, symptoms inevitably appear: loss of libido, impotence, fatigue, muscle, and bone weakening. When properly replenished, the benefits are clear and proven. It is important to be aware of the risks. The testicles can atrophy. Treatment should not be stopped abruptly, and in patients with prostate cancer, testosterone should be avoided. But in healthy men, with medical supervision, replacement can restore energy, sexual potency, muscle mass, mental clarity, and even bone protection. The penis does not decrease with replacement. On the contrary, it may appear larger due to improved circulation and weight loss. However, the testicles can indeed shrink in size because they are no longer stimulated to produce the hormone naturally. These are facts. What is clear is that the decision to replace testosterone cannot be based on myths or rumors, but on science, tests, and professional monitoring. Ignoring hormonal deficiency is accepting a life of symptoms that rob men of vitality. And now, I want to ask you something. If this content made sense, if it clarified doubts that many men are still ashamed to expose, share this video. There is a huge number of men living in silence with symptoms of testosterone deficiency, believing in false information, and perhaps you can be the one responsible for bringing the truth to them. A big hug, and see you in the next video.